Tonight on 60 Minutes.
What a mess.
At the age of 18, he looked like an old man with no teeth in.
Our kids at risk.
I begged them not to take them out.
In the dentist chair.
You look in the mirror now, what do you see? A handsome young man?
Well, yes, obviously.
Check out the glossy magazines and you'll be dazzled by the Hollywood smiles. It's the kind of pressure parents and teenagers can do without, especially as the perfect smile costs around $5,000. And then there's the torture. It can mean losing a few teeth and months trapped in braces. But what if that traditional treatment was doing more harm than good? What if it was actually damaging your face? Well, that's at the centre of a bitter row in the world of orthodontics, where a group of mavericks is a maverick, dead against the popular treatment we take for granted, pulling out teeth and putting on braces. Sure, you'll have nice straight teeth, but, and here's the real revelation, often your face will actually end up looking less attractive. Have you damaged faces in the past?
Well, look at mine. My father treated me by taking 4 teeth up here and pulling everything back, and I've now got a very long face, very flat cheeks, and a big nose. I might have been a good-looking chap.
To get a clearer idea, you should meet identical twins Ben and Quentin Creed. They're a classic test case. Ben had traditional treatment, 4 teeth out, and braces. Quentin tried Dr. Mew's method. No extractions, no braces. Now, you can definitely tell them apart. Quentin, what's your opinion of the result?
Well, I think it speaks for itself, doesn't it? It's blatantly different from being a mirror image to having different features altogether. I've got more pronounced cheeks, longer jawbone, more pronounced than my brother's, bigger smile, more full lips. I've got a longer face, the smaller smile, less pronounced features, and just generally more of a flatter face.
Do you see that as a result of braces and extractions?
Yeah, it's probably due to the extractions and the braces that I had, yeah.
In this face, the upper jaw is back.
The crux of Dr. Mew's argument is that extraction and braces push the face back, making it flatter and longer.
The orthodontists prefer what they call a straight face. I like a full face, with the front part of the face further forward. All your film stars have that face.
So, how does Dr. Mew achieve this kind of film star good looks? Straight teeth and perfect cheeks and lips. Well, to put it simply, instead of removing teeth to fit the jaws, Dr. Mew changes the shape and size of the jaws to fit the teeth.
We took her jaw forward, although it looks too far forward there. In fact, she finished at the end of the first stage of treatment with it looking even worse here. But of course that unlocked the lower jaw, which then enabled that to be brought forward, and we eventually finished with her looking like that.
Really, it's quite shocking how little jaw I had and goofy I was.
18-year-old Andrew Hall is another of Dr. Mew's success stories.
When you look in the mirror now, what do you see? A handsome young man?
Well, yes, obviously. Much better. I'm very glad I didn't end up just staying like that, because it is quite atrocious.
Has it had a flow-on effect in terms of your self-esteem and confidence?
Yes, I could see how it would have I might have not been quite so confident had I not been this good looking.
When you look at a patient's smile who've had teeth out, you can see the teeth are straight, but there's no fullness to the lip. When I lecture internationally, this is commonly known as the Sydney smile.
Sydney orthodontist Dr. Derek Mahoney has a similar philosophy to Dr. Mew. He says pulling out teeth is the easy option for the orthodontists, but usually not the best option for the patients.
I would say in clinical practice, 8 out of every 10 patients that go to the traditional orthodontist are having teeth removed.
80% of people.
80% of patients. Big R.
Dr. Mahoney does use braces, but extracts teeth in fewer than 5% of patients.
Last year I saw 163 people for second opinions. And of those 163, we were able to treat all without extractions.
And what had they been told by the traditional orthodontist?
They had been told that they needed at least 4 teeth out, and possibly then the extraction of their wisdom teeth after treatment. So that's nearly 8 teeth.
We've got a survey that shows that 60% of treatments done by orthodontists in this country are done without extracting teeth.
Well, that looks very good.
Dr. Jeff Wexler is spokesman for the Australian Society of Orthodontists, and not surprisingly, he supports the status quo.
40% of people in this country are having extractions according to your research.
It's not my research, but yes, according to the best research, which is very authoritative in the country.
But the Australian Orthodontic Society put its name to this study?
It's not their research. It will be published in due course, and I believe it belongs to the University of Adelaide.
So is Derek Mahoney wrong in saying that the extraction rate in Australia is 80%?
Derek, no. He's just quoting you his own experience. And there are lots of different variations in orthodontic practices. That's normal.
Well, how about this example? 19-year-old Michael Buggy went to 6 Sydney orthodontists for his condition, some minor crowding. All insisted he lose 4 teeth. But his mother Valerie wasn't so sure.
And I was horrified because I didn't think that he had such a big problem. And I begged them not to take them out. I said, isn't there, in all the knowledge that you have and all the studying that you've done, isn't there another way? But they were quite steadfast that, no, the teeth have got to come out or the problem would come back.
Finally, Valerie gave in and took Michael to the dentist for the extractions.
And he was just at the point of having them out. She had all the tools in her hand. And she said, you don't want this to happen, do you? And I said, no, I don't. But what else can I do? And as luck would have it, she gave me this dentist card and said, give him a ring.
That card belonged to Derek Mahoney, and he straightened Michael's teeth without extractions.
I would like to actually show these orthodontists that said to me, you'll be back, you'll be sorry. I'd like to show them his smile now, and I just wish that orthodontists would get together and give any mother like me the opportunity not to have the teeth taken out.
Can I show you this patient here? Do you think he needs extractions?
Well, I wouldn't.
You wouldn't?
No.
6 eminent orthodontists recommended to this patient's mother that he needed to have the classic 4 on the floor.
What you've presented me here is part of the information. Based on what you've shown me, I wouldn't. But there might be other factors that you haven't shown me in this patient's diagnosis.
He's had very successful treatment with Derek Mahoney without extractions. Does that surprise you?
No.
Are faces being damaged by traditional extraction type orthodontics?
I haven't seen any evidence at all to say that faces are being damaged in general.
Try telling that to dentist Dr. Mike Fennell. He pulled out 4 of his son's teeth on the advice of an orthodontist. The result, David's face ended up looking like this.
It ruined the look of his mouth. So from the nose upwards, he looked great. But from the nose downwards, he just looked terrible. But how do you tell that to your son? In fact, he looked like an old man. At the age of 18, he looked like an old man with no teeth in.
Is damaged the right word?
Yes, it is really.
Traditional orthodontics did that to his face?
They did, yes. Yes.
If you look at Zoe, what's caused all this crowding is really not genetics. It's more related to the way she breathes. And if you open really wide there, Zoe, here we are, you can see that narrow top jaw, V-shaped arch.
Dr. Mahoney says the key is to diagnose the problem and start treatment at an early age. And the problem often starts here in the roof of the mouth. When children suck their thumbs or breathe through their mouths, it can be pushed in. And this narrowing can have a knock-on effect. The lower jaw's forced back and down, producing what most of us would call buck teeth.
We can treat as early as 6 and 7. The benefit of treating early is that we're working with growth, and as a result we're making the space before the eruption of the teeth. So I think age is the most important factor that separates the new approach to orthodontics to the traditional approach.
90% of orthodontic treatment is done in Australia according to the education and training of the specialists. It's done after the age of 10. And the main reason, I think, is simply that the teeth don't come through until after the age of 10.
But Doctors Mew and Mahoney would argue that it is imperative to treat them at a young age because that's when they're growing. That's where they can change the mouth structure and the jaw structure.
Once again, you've got one or two people going against the rest of the orthodontists in the country who think that a few people should be treated early. Probably most people should be assessed early to catch the few, and the rest should be followed closely and treated at the most appropriate time, which turns out to be later.
It's very easy to have a production line in orthodontics where everyone comes in at a certain age, has a certain number of teeth out, and goes through the orthodontic process. I think a lot of traditional orthodontists aren't used to dealing with young children, and as a result it's a far easier approach for them to deal with the mainstream 14-year-old extraction type case.
What, young kids just put in the too hard basket?
Absolutely.
Is patients' welfare being compromised here?
I think patients' choice is certainly been denied, and ultimately patients' end results aren't as good as they could be. I'm saddened for the profession to think that there's so many people who aren't willing to offer their patients at least the choice.
It would be slightly better if her cheeks were a little fuller, like that.
Dr. Mahoney and Dr. Mew are by no means alone in this crusade, but they're battling against a powerful establishment.
It's amazing. If you challenge conventional orthodoxy, you will be resented. It's a lot of all those who try and change the system.
And even if the traditionalists don't agree, Dr. Mew says his results speak for themselves.
I must say I've been amazed how deeply resented I am at times. I mean, I've even been threatened with assault at meetings. People hate me with a depth that's really quite surprising.
Ultimately, though, perhaps we should leave the final judgment to the patient, like the now not-so-identical twins, Ben and Quentin. After all, they have to live with the results.
I'd definitely go for Mr. Mew's method. Yeah. Would you? Yeah. I think if I had the option again, then I would go for Mr. Mew's method. And the fact that, yeah, it does give better results. Quentin got the better deal. His treatments, obviously, without the extractions, he's got better features. He's more pronounced, and mine are less pronounced and a smaller smile.
How do you go with the girls then? You say that Quentin has a better smile.
He may have a better smile, but it's all the chat up and everything else. It's not just the facial features that counts.
Before we go, a word on our website. Standing by now to answer your questions is orthodontist Dr. Derek Mahoney from Our Straight Talk Story. Our address is 9msn.com.au, then go to the 60 Minutes site.
And just when you thought it was safe to dive back into the mailbag, Jules. Peter Overton's report on the Great Australian Smile and the extractions, physical and financial, so many of you go through. It's painful, expensive, and maybe unnecessary.
Last year I saw 163 people for second opinions. And of those 163, we were able to treat all without extractions.
And what had they been told by the traditional orthodontists?
They had been told that they needed at least 4 teeth out and possibly then the extraction of their wisdom teeth after treatment. So that's nearly 8 teeth.
I'm a general dental practitioner, And I absolutely agree with Dr. Mahoney that patients who undergo orthodontic treatment have teeth extracted. I was delighted to see your program because perhaps now parents will start asking more questions about treatment offered to their kids. Take them out, don't take them out. For some, it's all too hard. Why don't people accept that what they're born with is what they're meant to have, and that interfering with nature is not necessarily free from unwanted side